Okay, so today we're diving into a topic that's right up your alley, behavioral health emergencies. And we're going deep, using actual EMT training materials, textbook excerpts, even some quiz questions to keep things lively.
You know, what's interesting about these sources is they don't just regurgitate the textbook stuff. They get into the nitty-gritty of how EMTs actually handle these situations out in the field, the real world stuff.
And knowing you, you probably appreciate that they dedicate a good chunk to debunking some common myths surrounding behavioral health emergencies.
Oh, absolutely love a good myth-busting session.
So, one that stood out to me, and this is something I think a lot of people get wrong, is this idea that anyone having an emotional or behavioral crisis is automatically mentally ill.
Yeah, that's a big one. It's important to remember that people react to stress in different ways.
Totally. Think about it. You've got a patient who just went through a divorce, just lost their job, or even a loved one, right? They're going to be an emotional wreck.
Right, it's a natural human response. Doesn't automatically equal mental illness.
Exactly. It's like assuming someone's having a heart attack just because their heart's racing after a sprint to catch the bus. Right.
Exactly. It's all about context.
Speaking of misconceptions, another one that popped up was the idea that everyone with a mental health condition is inherently dangerous.
Yeah, that's another big one. And it's just statistically not true. It's actually a
Yeah.
very small percentage.
That,
But, and this is important, as EMTs, you are more likely to encounter those individuals just because of the nature of emergency calls.
that makes sense.
But it's important to remember, not every behavioral health emergency equals a dangerous situation.
So then how do you, as EMTs, how do you approach that line? How do you differentiate between what's just a normal reaction to a really tough situation or really stressful situation and what actually constitutes a behavioral crisis? What are the red flags that you're looking for?
Yeah, it all comes down to coping mechanisms, really. We all develop our own ways of dealing with stress, right?
Yeah.
But sometimes life throws us a curveball, so intense, so outside the realm of our normal experience that our usual coping mechanisms, they just can't keep up.
Okay.
And it's like pushing your car engine too hard for too long. Eventually, it's going to overheat and stall.
Okay, I like that analogy.
Yeah, so instead of the engine stalling, in a behavioral crisis, you might see behaviors that are agitated, violent, uncooperative behavior, actions that put themselves or others in danger.
Okay. So it's that inability to cope, that kind of engine overheat that manifests in these outward behaviors that then become a cause for concern.
Exactly.
And that's your cue as an EMT to step in and try to manage the situation.
Right, and it's not about diagnosing them with, this condition or that condition, but making sure everyone's safe.
Yeah, because the causes behind these calls can be so varied, right? It's not always a clear-cut case of, oh, this person has a diagnosed mental health condition. It could be substance use, extreme stress. It could even be a medical issue that's messing with their mental state. Like imagine someone having a diabetic emergency, right?
Exactly. So many different potential factors at play.
Yeah.
And that's actually why the training materials, they emphasize understanding the bigger picture of mental health disorders.
Yeah, because it's not always immediately obvious what you're dealing with.
Exactly.
I was blown away by the sheer prevalence of anxiety disorders alone.
Oh, yeah.
We're talking generalized anxiety, panic disorder, phobias, PTSD, OCD. The list goes on.
That's just one category, too.
Yeah.
Add in things like, schizophrenia, bipolar disorder, depression.
Right,
You
right.
start to realize how important that multi-level system of care really is.
And thankfully, we do have that system in the U.S., right? We've got counselors, psychologists, psychiatrists, all these different levels of care depending on the severity of the condition.
Right. And while most people with mental health conditions can manage their symptoms with, regular outpatient visits, sometimes hospitalization in a specialized behavioral unit is necessary.
Right, and that's a whole other ballgame.
It is.
But again, as EMTs, you're not there to diagnose. You're focused on scene safety and getting that patient the appropriate care.
Exactly.
Now, this next part in the source material, I found it really fascinating. They delve into the physiology behind these behavioral emergencies. And they make this distinction between what they call organic and functional disorders. Can you elaborate on that a bit?
Sure, yeah. So with organic disorders, you've got an identifiable physical problem that is affecting how the brain functions.
Okay.
So this could be anything from a sudden illness, a traumatic brain injury, effects of substance abuse, even something like Alzheimer's disease.
So there's a physical culprit.
Exactly, exactly. Now, functional disorders, those are a little bit different. Those are going to be your psychological or behavioral symptoms without that clear-cut physical cause.
Yeah.
So things like schizophrenia, anxiety disorders, depression.
So less about pinpointing a specific, physiological issue and more about,
It's not that there isn't something physically happening in the brain, but
Yeah.
it's more about like the interplay of psychological and environmental factors.
interesting. So for EMTs in the field, how does knowing the difference between an organic versus functional disorder actually change their approach?
That is a great question. So if you, the EMT, suspect an organic cause, right? Let's say your patient seems delirious and their family's like, oh yeah, they have a history of diabetes.
Yeah.
Your priority might be to check their blood sugar.
Right.
Just
Right.
address that potential medical emergency.
Address the underlying cause.
Exactly. But with a functional disorder, something like schizophrenia, for example, your focus shifts more towards de-escalation, building rapport, creating a safe environment for the patient and everyone around.
It's fascinating how much context matters in these situations.
It really does. And speaking of context, no matter what type of behavioral emergency you're facing, there's one thing that always needs to be front of mind: scene safety.
Of course.
Paramount. And the source material, they really hammer that home.
Right, because even if the patient themselves isn't intentionally trying to hurt anyone, their behavior during a crisis could inadvertently put themselves or others at risk.
Exactly. Exactly.
So it's not just about the patient's safety, right? It's about everyone involved.
It's about your safety. It's about your partner's safety, the safety of bystanders, everybody. You need to be evaluating the situation from a very tactical perspective.
Right.
Is the scene secure? Are there any potential weapons in sight? Do I need to call for law enforcement backup immediately? Or should I stage a safe distance away until the scene is secure? These are the questions that should be going through your mind before you even think about approaching the patient.
So you're almost approaching it like you would a crime scene in a way. You're looking for potential dangers, you're making sure that you and your team are safe before you even engage.
100%.
So you've determined it's safe to approach. How do you actually assess a patient who's having a behavioral emergency? It's not like your typical trauma assessment, right?
Right. It's different because you have to factor in that behavioral component right from the start.
Okay, so instead of rushing in,
Instead of rushing in, you hang back, you observe their behavior from a safe distance, and you do that rapid physical exam, just like you're trained to do. But you're also looking at their mental state. How are they acting? Are they agitated, withdrawn? Are they making eye contact, or are they looking around nervously?
right, because so much of communication is nonverbal, right? Like if a patient's pacing back and forth, wringing their hands, that tells you something's wrong, even if they're not saying a word.
Exactly, exactly. And don't forget to check their alertness. Are they alert? Are they responding to just voice? Are they responding to pain? Or are they completely unresponsive? And then try to establish some rapport.
Right.
A calm, reassuring voice can go a long way in de-escalating a tense situation. And if there are family members or bystanders around, try to glean some context.
Right, like what's their baseline? Have they been acting differently?
Exactly. They might be able to shed some light on the patient's history, medications, triggers, things like that.
Speaking of history, our EMT training materials, they really drilled in the importance of thorough history taking during a behavioral health emergency.
Oh, for sure. I mean, that history is like piecing together a puzzle. It can give you those crucial insights.
So what kind of questions are we talking about here? What's crucial in these situations?
So you want to be asking about anything that might be influencing their mental state. So their central nervous system function. Are they having any dizziness, headaches, seizures, any recent substance use? Significant life changes or stressors, things like loss of a job, death of a loved one. And of course, any history of mental illness is important to know about.
Okay, so you're really trying to paint a picture of their overall well-being, not just what's happening in that exact moment.
Exactly. And it's not just about the questions themselves. It's how the patient answers. Are they responding appropriately? Is their speech coherent? Are they making eye contact or are they withdrawn?
Right, those nonverbal cues can be just as telling as their words.
Absolutely. And those observations, they become even more crucial during the secondary assessment, especially if the patient is unconscious.
Right, because then you don't have that verbal back and forth to guide you.
Exactly. So if they are unconscious, you're automatically thinking, okay, what are the potential causes here? Ruling out trauma, especially head trauma, that's critical.
Yeah.
But you're also looking for things like track marks that might suggest substance abuse, any evidence of self-mutilation that might point to suicidal behavior. And don't forget to consider what led up to them becoming unconscious. Was there any physical agitation, a struggle, possible use of stimulants, or even tasers? Those details matter.
Right, it all adds to the picture.
Exactly.
And if the patient is conscious but not communicating clearly, I imagine that's when your EMT observation skills really come into play.
100%. You've
Yeah.
got to be really tuned in. Pay close attention to their facial expressions, their pulse. Are they breathing fast? Are they sweating, blushing, crying? Even their eye movements, like are they staring blankly or are their eyes darting around? It can all give you clues. It's like connecting the dots.
Okay, so let's say you've assessed the scene. You've done your primary and secondary assessment. You've gathered as much history as possible. Now you're faced with the decision of whether or not to transport, and if so, where. What are the key factors you're considering here, especially when it comes to behavioral health emergencies?
Well, the decision to transport is based on the same criteria as any other emergency, the patient's condition, and whether they need a higher level of care. But with behavioral health, there are a few specifics to keep in mind.
Like what?
Well, for starters, it's often a good idea to have law enforcement accompany you in the ambulance, especially if the patient is agitated, combative, or a potential danger.
Right, better safe than sorry.
Exactly. It's for everyone's safety, yours included.
Yeah.
And if you've got facilities in your area that are specifically equipped to handle behavioral health emergencies, those should be your go-to whenever possible. They're going to have staff who are trained to deal with these situations.
Right, it's not just a standard ER visit.
Exactly.
And you know me, I can't resist a good documentation reminder. I'm guessing that's even more crucial in these situations where you've got a potential behavioral health component.
Oh, you better believe it. Documentation is your best friend in these situations. If restraints are used, and remember, that should always be a last resort, document the type of restraints, why they were necessary, the patient's response. The more detailed your documentation, the better.
CYA.
Exactly.
Okay, let's dive into some specific conditions that EMTs might encounter. The training materials spent a good amount of time on acute psychosis, which sounds pretty intense.
It can be. Imagine being completely detached from reality, convinced of things that aren't true, maybe even seeing or hearing things that aren't there.
Yeah.
That's acute psychosis.
Wow, that's a lot to process, even just trying to imagine it.
It's like their mind is playing tricks on them. And it can be caused by a lot of different things, from extreme stress or substance use to medical conditions like infections or head injuries. But it's also a hallmark of some serious mental illnesses like schizophrenia.
That's the one where people might have delusions and hallucinations, right? I feel like schizophrenia is one of those conditions that's often really misunderstood.
Yeah, there's definitely a lot of stigma around it. What's important for EMTs to remember is that schizophrenia is a chronic, complex condition. It affects a person's thoughts, feelings, behaviors. They might have trouble distinguishing between what's real and what's not. Their thinking and speech can become jumbled.
So it's not just, a matter of them, like, choosing to see things differently.
No, not at all. It's a real physiological condition.
Right, and it can be very frightening for the person experiencing it.
Exactly. And it often leads to unpredictable, sometimes risky behavior.
Okay, so if you're an EMT responding to a call where someone might be experiencing psychosis related to schizophrenia, how do you even begin to approach that situation?
The same principles apply: scene safety, patient assessment. But there are a few key things to remember when you're dealing with someone who might be psychotic. First and foremost, stay calm. Your calmness can help them feel safer. Approach slowly. Introduce yourself clearly.
Don't just rush in.
Right, and here's a big one. Don't argue with their delusions or try to convince them that what they're experiencing isn't real.
Oh, that's tough, though. Because if you see someone who's clearly not in touch with reality, your instinct is to try and, like, reason with them, right?
Right, but in their mind, it is real. And challenging their reality is only going to escalate the situation.
Okay, so it's kind of like telling someone with a broken leg that their pain isn't real. It's dismissive.
Exactly. Instead of arguing, try to validate their feelings without confirming their delusions. You could say something like, I understand that you're seeing something that I can't see, but I'm here to help.
Okay, that makes a lot of sense. And involves someone they trust, if possible.
Exactly. A family member, a friend, someone who might be able to help ground them and maybe even de-escalate the situation.
Right, because in those moments, familiarity can be really comforting. Is there anything else that's helpful for EMTs to know about psychosis and schizophrenia?
One key takeaway, and this is important, even people with schizophrenia who are on medication can still have what we call breakthrough psychotic episodes.
Oh, wow. So it's not always a matter of them, like, not taking their meds.
Right. Sometimes the medication just can't fully control the symptoms. So even if a patient says, oh yeah, I'm on my meds, You can't just let your guard down.
You still need to be cautious.
Absolutely. Always prioritize scene safety, assess the patient carefully, and don't hesitate to call for backup if you need it.
All right, moving on to another intense scenario that the training materials highlighted, excited delirium. That term alone just sounds alarming.
It's a serious medical emergency. Basically, you've got bizarre and aggressive behavior, often accompanied by incredible strength and a high tolerance for pain. It's like their body's fight or flight response is stuck on overdrive.
And the source material actually mentioned that it can be fatal.
Oh, yeah. This isn't just someone acting out. This is a life-threatening condition. We're talking cardiac arrest, respiratory failure,
Yeah.
death.
Wow. So this is serious. So what are the red flags? What should EMTs be looking for?
It often starts with altered mental status, confusion, agitation, paranoia. But what sets it apart is this extreme hyperactivity and aggression, often coupled with, like, superhuman strength and a bizarre tolerance for pain. The patient might be ripping their clothes off, yelling, running into traffic, seemingly oblivious to the dangers.
It's like they have no sense of self-preservation in that moment.
It's like their internal alarm system is completely offline. And remember that heightened fight or flight response we talked about.
Right.
Their heart rate's going to be through the roof, their breathing's rapid, their body temperature might be elevated, they might be sweating profusely. They're basically a runaway train, both mentally and physically, and it takes a toll.
Okay, so this is a lot to take in. Let's break it down.
Mhm.
How should an EMT approach a situation like this? What's the first move?
First and foremost, scene safety. Always, always, always. And with excited delirium, that's even more crucial because the patient's behavior can be so erratic.
So we're talking assessing the scene for potential dangers, not just to the patient, but to yourself and everyone else around.
100%.
Yeah.
Is the patient armed? Are they in a public place where they could potentially harm bystanders? Do I need to call for law enforcement backup immediately? These are the questions that need to be answered before you even think about approaching the patient.
So you're thinking tactically.
Absolutely.
And assuming the scene is secure, how do you approach someone in the throes of excited delirium? I can only imagine it's not easy.
It's a delicate balance.
Yeah.
You want to be compassionate and understanding, but you also need to be firm in control of the situation.
Mm-hmm.
Approach slowly and calmly. Use a soothing tone of voice. Identify yourself clearly. Hi, I'm your name. I'm an EMT. I'm here to help. And try to make eye contact if possible.
What about physical contact? I imagine that could escalate things quickly.
You are absolutely right. In general, it's best to avoid unnecessary physical contact. Remember, they are often in a state of sensory overload. Even a light touch could be perceived as a threat.
Right, their fight or flight response is already on high alert.
Exactly.
Okay, so you're approaching calmly, keeping your distance. What's next?
Try to de-escalate the situation verbally. Use simple, clear commands. Sir, I need you to sit down. Ma'am, please stay where you are. And avoid getting into arguments or trying to reason with them.
Right, because their thought processes are likely all over the place.
Exactly. Logic and reason often don't work here. It's more about taking control of the situation and keeping everyone safe. And if they're willing to talk, let them talk. Sometimes just letting them vent can help de-escalate things. But if they're not cooperative, if they're becoming increasingly agitated or aggressive, that's when you need to step back, maintain a safe distance, and let law enforcement handle it.
Right, it's about knowing your limits and recognizing when it's time to call for backup.
Exactly.
So let's say you've called for backup, law enforcement is on scene, and the decision is made to restrain the patient. This is always a last resort, right?
Always. Restraining a patient, especially one experiencing excited delirium, should only be done when absolutely necessary to prevent harm. And it's not something EMTs should be doing on their own. It requires a coordinated effort with law enforcement.
It's a team effort.
Absolutely. You need a team of at least 5 people, ideally. 1 for each limb and 1 for the head, to safely restrain the patient without causing injury.
5 people. That really highlights how serious this condition is.
It really does. And even once the patient is restrained, you're not out of the woods yet. That post-restraint monitoring, that can be a matter of life or death.
So you need to be on high alert.
You're monitoring their vital signs constantly and be prepared to address any complications. Remember, this is a true medical emergency.
It's not just about subduing them, it's about keeping them alive.
100%.
Okay, let's shift gears a bit to a topic that's unfortunately all too common: suicide attempts. The source material really stressed that while depression is a major risk factor, it's rarely the only one.
Absolutely. And, there's this dangerous misconception out there that If someone is talking about suicide, they're just looking for attention, that they won't actually go through with it.
Which is such a dangerous and potentially deadly assumption.
100%. You have to take every suicidal statement, every behavior, seriously, even if the person's attempted suicide before, or even if they seem to be joking about it. You can't just brush it off.
So, what should an EMT be looking for when responding to a potential suicide attempt? What are some red flags?
Well, obviously, if you find someone who has clearly attempted to harm themselves, like they've overdosed on pills or they're bleeding from self-inflicted wounds,
Right.
that's a no-brainer. But sometimes the signs are much more subtle. They might be talking about feeling hopeless, helpless, like they're a burden to others.
Or they might be giving away their belongings, saying goodbye to loved ones, writing suicide notes, things like that.
Exactly. Those are all huge red flags.
Yeah.
And honestly, don't underestimate the power of intuition. If something feels off, if your gut is telling you something is wrong, trust your instincts and dig deeper.
Don't be afraid to ask the tough questions.
Right.
So, once you've established that someone might be suicidal, what's the best way to approach them? I know that can be a really delicate situation.
It is. Like with any behavioral health emergency, a calm and empathetic approach is key. Introduce yourself, express your concern, and let them know you're there to help. And if they're open to talking, encourage them to share their feelings without judgment. Sometimes just having someone to listen can make a world of difference.
What about asking them directly if they're thinking about suicide? I know some people are afraid to ask that question because they think it might plant the idea in the person's head, but our training materials actually said that's a myth.
It is a myth. Asking someone directly if they're thinking about suicide won't make them more likely to do it. In fact, it can actually be really helpful because it shows them that you're taking their feelings seriously.
Okay, good to know. So you're not putting the idea in their head, you're opening up a space for them to talk about it if they need to.
Exactly.
So let's say you're on scene with a patient who has attempted suicide or is expressing suicidal thoughts. What are the key steps in managing that situation?
Okay, first and foremost, just like always, scene safety. If they've attempted suicide using a firearm, for instance, you need to make sure that weapon is secured before you approach. If they've overdosed, try to collect any pill bottles or substances that might give you clues about what they've ingested.
Right. Scene safety first.
Always. Once the scene is safe, you approach the patient calmly and empathetically. Introduce yourself, express your concern, let them know you're there to help. Even if they're unresponsive, continue talking to them throughout the assessment and treatment process.
Really? Even if they can't hear you?
Even then, hearing a calming voice can be reassuring, even if they're not fully conscious. And remember, even if the patient seems stable, anyone who's attempted suicide or expressed suicidal thoughts needs to be transported to the hospital for further evaluation and care.
Absolutely. A suicide attempt is a cry for help, and it's crucial to connect that person with the mental health resources they need.
Exactly. And don't forget to document everything. The scene, the patient's condition, any statements they made, any treatments you provided.
Documentation. Documentation. It's like a broken record on this show, but it's so important.
It is. That documentation provides valuable information for the receiving hospital, and it can also help protect you legally down the line.
Okay, let's move on to another specific population that often faces unique challenges, those struggling with PTSD or post-traumatic stress disorder. The training materials emphasize that PTSD isn't just a soldier's disease.
Exactly. It can happen to anyone who's experienced or witnessed a traumatic event. A car accident, a natural disaster, sexual assault, a violent crime. It's the body's natural response to an unnatural event.
And it can manifest in so many different ways.
Absolutely. It's not one size fits all. Some people have flashbacks or nightmares, reliving the traumatic event over and over again. Others feel emotionally numb, like they're just going through the motions. They might avoid places or situations that remind them of the trauma, or they might be easily startled, hypervigilant, always on edge.
So for EMTs responding to a call where someone might be experiencing PTSD, how do you differentiate between those symptoms and, say, someone who's just having a bad day? I imagine it can be tricky.
It can be, especially because people with PTSD don't always present with obvious symptoms. They might not even tell you about the traumatic event, either because they don't want to talk about it or because they don't connect it to their current symptoms.
So it's not always as straightforward as, oh, this person was in a war zone, so they might have PTSD.
Right. It could be a lot more subtle than that.
So what are some clues that might suggest PTSD?
One thing to look for is their demeanor. Are they on edge? Easily startled? Hypervigilant? Constantly scanning their surroundings for threats? They might also be very guarded, reluctant to engage with you, which makes sense given what they've been through, and pay attention to their body language. Are they fidgeting, trembling, breathing rapidly?
Those are all signs of anxiety, right?
Exactly, which is really common with PTSD.
So if you suspect someone might have PTSD, how should you approach them?
Same principles apply. Remain calm, speak in a gentle, reassuring tone. Avoid making any sudden movements. Don't raise your voice. Introduce yourself, explain why you're there, and ask if there's anything you can do to help.
And should you ask them directly if they've experienced a traumatic event?
That's a judgment call. You can certainly ask if they've ever been in a situation that they found really scary or upsetting, but don't press them for details if they're not ready to talk about it.
What about physical contact? Is it okay to touch someone with PTSD, or could that be triggering?
Another great question. People with PTSD often have a heightened sense of personal space, so it's generally best to avoid unnecessary physical contact. If you need to examine them, explain what you're doing before you touch them and ask for their consent.
Right, it's all about respect and giving them a sense of control, which they might feel like they've lost.
Exactly.
Okay, so let's say you are treating someone with suspected PTSD and they start having a flashback or a panic attack. What's the best way to handle that?
First, try to stay calm yourself. Remember, their behavior is a symptom of their PTSD, not a personal attack on you. Try to remove them from the triggering environment, if possible, and speak to them in a calm, reassuring tone. Let them know that they're safe and that the flashback will pass.
What if they're not responding to your verbal cues?
If they're not responding and they're becoming increasingly agitated or aggressive, you might need to create some distance and call for backup.
Right. Sometimes you need to prioritize the safety of everyone involved. And again, physical restraints are generally not a good idea with someone experiencing a PTSD episode.
Exactly. Restraints can be very triggering for people with PTSD, and they often escalate the situation rather than de-escalating it.
It's all about de-escalation, creating a safe and supportive environment. We've talked a lot about PTSD in general, but the training materials also highlighted some specific considerations for EMTs interacting with combat veterans who might have PTSD. Is there anything in particular that stands out?
Yeah, for sure. There are definitely some nuances there that are important to be aware of.
Like what?
Well, for starters, combat veterans might be more accustomed to a direct, authoritative communication style. So approaching them with a calm, firm voice, while still being respectful and compassionate, can be very effective. But at the same time, it's important to avoid using any military jargon or phrases that could trigger a negative reaction.
Interesting. So it's about finding that balance between being authoritative but approachable.
Exactly. And because combat veterans are often used to a hierarchical structure, clearly identifying yourself as an EMT and explaining your role can help establish your authority and build trust.
Okay, so what else is important to keep in mind when you're interacting with veterans who might have PTSD?
Well, be patient. These guys have been through a lot, and building rapport might take a little longer. And, military personnel are often trained to be very resourceful and self-reliant.
Right. They're the ones who are supposed to be taking care of other people, not the other way around.
Exactly. So they might be reluctant to ask for help or admit that they're struggling. So you got to be really tuned in to those nonverbal cues.
Okay, so look for those unspoken signs. Got it.
And don't forget, veterans with PTSD are at an increased risk of suicide. So it's crucial to ask them directly about suicidal thoughts or intentions. Don't shy away from those tough conversations.
Okay, we're nearing the end of our deep dive here, but there's one more thing I want to touch on before we wrap up. Traumatic brain injury, or TBI. The training materials mention it as something that often goes hand in hand with PTSD, especially in combat veterans.
Oh yeah, TBIs are incredibly common in combat, especially with IEDs and blast injuries. And the thing is, TBIs can cause a whole range of cognitive, emotional, and behavioral changes that can easily be mistaken for PTSD or other mental health conditions.
So how do you tell the difference between TBI and PTSD? Because it sounds like there's a lot of overlap there.
That's where things get really tricky. There's a lot of overlap in the symptoms. That's why it's so important to get a thorough medical history, if possible. Ask about any history of head injuries, concussions, or exposure to blasts.
Right, because those details might not be immediately obvious.
Exactly. And don't forget, TBIs can also increase the risk of other mental health problems like depression, anxiety, and even substance abuse. So if you're treating a patient with a suspected TBI, be on the lookout for signs of those conditions as well.
So it's not always just about the immediate physical injury, it's about the potential long-term effects as well.
Exactly. It's about the big picture.
Okay, so let's say you're responding to a call and you suspect the patient might have a TBI. What are some key things to keep in mind when assessing and treating them?
One of the most important things is to minimize noise and sensory stimulation. People with TBIs are often very sensitive to light, sound, and movement.
So, all the commotion of an emergency scene?
It can be incredibly overwhelming. If possible, move them to a quieter location. Dim the lights in the ambulance. Try to limit the number of people crowding around them. And here's a tip. Avoid touching them or doing anything to them without explaining what you're doing first.
That makes a lot of sense. They're already disoriented and confused.
Exactly. And if you're responding in an ambulance, try to keep it a safe distance away to minimize the noise and the fumes from the engine.
Oh, yeah, good point. That stuff can be really aggravating for someone with a TBI.
It can.
It's amazing how many factors EMTs have to consider in these situations. Like you're constantly juggling a million things at once.
You're telling me. That's the job, right?
Yeah.
You never know what you're going to walk into, and you got to be prepared for anything.
It's incredible how much ground we've covered, and I feel like we've barely scratched the surface of behavioral health emergencies.
It's a vast and complex field for sure, but the insights from these training materials,
Hmm.
pure gold for EMTs, really practical stuff. One thing that stood out to me was the emphasis on communication, and not just with the patient, but with other first responders, especially law enforcement.
Oh, absolutely. That's huge. It's easy to get so laser focused on the patient's immediate medical needs that we forget about that bigger picture of scene management and collaboration. So, when it comes to these behavioral health calls, when is it absolutely essential to get law enforcement involved?
Well, here's the key difference to remember. Your primary concern as an EMT is the patient's medical well-being. Law enforcement, their primary concern is public safety.
Right, two different but equally important roles.
Exactly. So if a patient is posing a clear and present danger to themselves or others, call for backup immediately. Don't even hesitate.
Okay, so we're talking situations where there's potential for violence, harm to bystanders, that kind of thing.
Exactly. Also, if there's any suspicion that a crime has been committed, domestic violence, assault, elder abuse, anything like that, law enforcement needs to be involved. They're the ones who are trained to recognize those situations, gather evidence. That's not really an EMT's area of expertise.
Right, you have your lane, they have theirs.
Exactly.
What about situations where a patient needs to be transported for psychiatric evaluation, but they're refusing to go?
Good.
We talked earlier about how competent adults have the right to refuse care, but mental illness can sometimes, cloud judgment.
That's where things get really tricky. And it's another area where having law enforcement on scene can be invaluable.
Right, because they have the authority in those situations.
Exactly. If you, as an EMT, based on your assessment, believe that a patient is a danger to themselves or others because of a mental health crisis, but they're refusing transport, law enforcement can actually help facilitate that transport legally and safely.
So, in those situations, the police essentially have the authority to override the patient's wishes, but it has to be based on a legitimate concern for their safety or the safety of others.
Exactly. It's not about forcing someone to get treatment because they're acting out. It's about preventing harm. And of course, anytime law enforcement is involved, thorough documentation is more crucial than ever.
Yeah, it's like that saying, if you didn't document it, it didn't happen.
Right. Protect yourself. Document everything. The reasons for calling law enforcement, any actions that they took, the patient's behavior, any statements they made, everything goes in the report.
It's all about connecting those dots, creating a clear timeline of what happened and why.
Exactly. Now, I want to loop back to something we touched on earlier, the importance of dispelling those common myths and misconceptions surrounding mental health.
Right, because those stereotypes are so pervasive.
They really are. The source material really drives home how crucial it is to address these head-on.
It's so easy to fall into those traps of thinking that people with mental illness are inherently dangerous, unpredictable, or that mental health struggles are a sign of weakness.
And those misconceptions have real-world consequences. They create this stigma and fear that prevent people from seeking the help that they need. It's like having a broken leg but being too ashamed to see a doctor.
Wow, that's a powerful way to put it. So, what can EMTs do both in their professional lives and their personal lives to combat those stereotypes and promote a more compassionate and understanding approach to mental health?
Honestly, educate yourselves. These training materials are a great start, but don't stop there. Read books, listen to podcasts, stay up to date on the latest research. The more you learn about mental health, the better equipped you'll be to challenge those misconceptions.
Right, knowledge is power.
And it's not just about knowing the facts, it's about changing the conversation. Talk to your friends and family about mental health. Share what you're learning. If you see someone struggling, don't be afraid to reach out.
Little things can make a big difference. Maybe it's suggesting they talk to a therapist. Maybe it's just lending an ear, listening without judgment.
Exactly. And remember, mental health conditions are medical conditions,
Hmm.
just like heart disease or diabetes. They're not a character flaw. They're not a sign of weakness.
And seeking help is a sign of strength, not weakness.
100%.
As we kind of wrap up this deep dive into the world of behavioral health emergencies, I'm left with this lingering thought. We've talked a lot about how EMTs respond to these crises as they're happening.
Right.
But what about prevention? What can we do as a society to address those root causes of these behavioral health emergencies? Maybe even prevent some of them from happening in the first place.
That's the million-dollar question, right?
Yeah.
And, while there's no easy answer, it's a conversation worth having. It's about creating a world where mental health is treated with the same importance as physical health, where people feel comfortable asking for help without shame.
Where resources are accessible, they're affordable, and everyone has that support they need to thrive.
Absolutely. That's a future worth striving for. And remember, even small actions can create ripples of change. Never underestimate the impact you can have by just showing compassion, understanding, and a willingness to listen.
That is a powerful message to end on. This deep dive has been so eye-opening, and I, for one, am walking away with this renewed sense of purpose in my work as an EMT.
Me too.
Ah,
Keep learning, keep asking those tough questions, and never stop advocating for better mental health care. It matters.
couldn't have said it better myself. That's a wrap on today's deep dive, folks. Until next time, stay safe and stay informed.